A return to normalcy could be in sight if President Biden's latest effort to fight the COVID-19 pandemic comes together. His administration announced yesterday that it's working to buy 2 million more doses of the vaccine. The president said that he hopes to have enough shots to vaccinate 300 million people by the fall. That's more than 90% of the population. For more on this now, we want to bring in Dr. Neeta Ogden. She's an internal medicine specialist and immunologist. So, doctor, this sounds pretty good. What do you think of the president's efforts, and what else, if anything, do you think needs to happen? And we should point out, getting the doses, acquiring the doses is great, but you need a whole infrastructure to make sure that you can get those doses into people's arms, because we already have a lot of doses out there, and I think it's just a little more than 50% have actually been administered.
Good morning, and thank you for having me. Well, I think you're exactly right. This is a two-pronged situation. One is the vaccine supply, which you're right. We've had a pretty robust turnout so far, although states really complain about lags. And that goes to the second prong of this, that there's a huge federal plan that's going to be put into place to accelerate the state rollout of the vaccine, because they simply didn't have enough resources and organization in play, while they're also combating the virus, to adequately get the vaccines in everybody's arms. So now we see FEMA getting involved. Huge, massive vaccination sites are going to be developed. But at the same time, we need to get more doses of the vaccine. And Biden spoke about this yesterday, that in fact, the weekly amount of vaccines that are rolled out to the states will increase. We'll see 10 million a week rather than 8.5. And then longer term, we're seeing by March, hopefully, those large, doses that were promised and bought for Moderna and Pfizer vaccines are hopefully fulfilled. And then later into the summer, we reach that 600 million dose mark that could lead us to more of a herd immunity and more of a return to normalcy.
So, Doctor, CDC researchers are saying that students can go to school safely if they wear masks and continue to practice social distancing. But their latest article in the Journal of the American Medical Association also advises that indoor sports should stop and that cities and towns should close indoor dining. Do you agree that in-person learning is safe, and what do parents need to know?
Yes, I think that a number of studies from, internationally and from the CDC now look at that. The fact that schools are not a source of transmission with the right things in place. That includes, as you said, mask wearing, physical distancing, proper room ventilation, and then hopefully, as the Biden administration rolls this out, screening tests. We're really going to see schools as a quite safe place for children to be. Now, where did these studies actually see more transmission? Well, exactly what you said, indoor sports, and also social gatherings around sports, the carpools to and from, games and afterwards. So these are things that certainly have to be looked at. If we want kids to go to school, if we want to prioritize that, it's going to be essential to sort of eliminate these high-risk other situations and gatherings. And there's a lot of conflict about this. Some families indeed feel that schools should be remote and sports should continue to be in person. And I think that's been a real struggle in terms of states implementing the kind of rules for schools to be open. But more than anything, we need to see, the federal government also get involved with public schools getting resources so that they can adequately physically distance and have room ventilation. I mean, we have seen a little bit of disparity where it's, schools that have, more economic means can execute these kind of parameters. So it would be good to actually see this carried out more nationally as well.
So really quickly, Doctor, Regeneron came out with a study today saying that their COVID-19 antibody cocktail works against variants of the virus that have been found in the UK and in South Africa, and that's based on the virus's makeup. They believe as well that it would be effective on the variant that is coming out of Brazil. So this is the same cocktail that President Trump took when he was diagnosed with the coronavirus. This is Regeneron's own study they did on their own drug. The research is not peer-reviewed, so we have to kind of make that clear. But based on the information that you're getting, what's your sort of big takeaway from the study?
Yeah, I think you raise a really good point. We need it to be peer reviewed because if it's a study coming from the drug maker itself, you do worry about bias. But the reality is that cocktail involved more than one antibody. And where we see, the vaccine succeed and also even our own immune response is where there's a diversity of antibody responses. So when you involve more than one antibody, you're potentially going to have more success in combating these mutations because they're not just honing in on just that one mutation. It's not just all in one. So I think that there's hope for this, and indeed there's probably some, accuracy in their results just because of that diversity of antibody. We have a very diverse immune profile when we mount, from the vaccines or naturally a response to COVID. And I think that is something that really remains to be seen how it plays out with the variants. But that's what's giving immunologists a lot of hope in terms of combating this, as well as the fact that the vaccines, at least that we have, produce such an incredibly robust response that even some mild reductions still leads to protection.
All right, Dr. Neeta Ogden, always great to have you. Thanks so much for your perspective and analysis. We appreciate it.
Thank you for having me.